Welcome to the Elevate the Vibe podcast, bringing you juicy convos with thought leaders discussing the wild world of parenting.
I remember looking at my husband and I was like, whatever happens, we're going to be parents. Whether we adopt, whether we do embryo donation, we will be parents. I will be a mom. And I think just saying that out loud to him was so powerful for me to hear. Biologically, mine didn't matter. I will be a mom. And so we put a lot of these stresses on ourselves. And I think when you write it out or when you talk it out, it's very cathartic and it can be transformative.
What up, Vibe Hive? It's your favorite day of the week. It's Wednesday. That means it's a new episode of Elevate the Vibe. I'm your host, Jason Berlin, and with me is my beautiful, lovely co-host, Katie Berlin.
We are coming in strong through your headphones or your car speaker or wherever you enjoy listening to podcasts, and we are excited to share the story of our guest today. Our guest is a dear friend of ours, Preyasi Kothari. She is an emergency medicine physician located in Atlanta. She also is a fertility warrior, a mama, and a mama-to-be who has held it down in the city of Atlanta all during last year during COVID. Just an amazing human being who we are very proud to call our friend as well.
Not to mention, she is a masterful yogi as well. Katie and I met her on a yoga retreat outside of Cabo San Lucas a couple years ago, and she was just a delightful person to talk to and be around, and we're thrilled to have her on today.
So Vibe Hive, give your warmest welcome to our guest of the show today, Dr. Preyasi Kothari. Preyasi, welcome to the Elevate the Vibe podcast. Please introduce yourself to our audience.
My name is Preyasi Kothari. I am a board certified emergency medicine physician, but more importantly, I'm a mom. I am a wife, I'm a daughter, I'm a sister, and I am a fertility warrior.
Talking a little bit about your background as a doctor and an MD and how you got to this path, can you share with us when you were growing up, what that was like?
It's interesting. So I am the youngest daughter of two. My parents are both, Indian. They emigrated here when they were my dad was in his late teens, early 20s. My mom came soon after she was married. And from a very, very young age, it was instilled in us that education was so important. And, education was going to be our pathway to success and was going to provide us stability. And I think, I volunteered in high school in the hospital and I really enjoyed it. But I think truthfully, Indian children are usually either lawyers, doctors, or engineers. And so both my sister and I, ended up going into medical school. We were very lucky enough to be accepted into programs like right out of high school. So we went to college for 4 years and we had a guaranteed seat at a medical school. So I think education was always the foundation for most of our conversations. Like, how are we doing in school and what tests were we studying for? And so that's sort of how I got led to being a physician. I think there was a lot more independent decision making once I decided that I wanted to go to emergency medicine. I mean, when I started, it wasn't a very common field that my parents knew about or even my family knew about. But it was the one field that when I walked into the ER as a med student, I felt like I was alive and I felt like I could do my best work taking care of these patients. It's a high intensity, high adrenaline. You have to be highly adaptable while working in the ER, but there's also a lot of calmness and comfort that we as physicians provide to our patients. And I think that's really what I fell in love with.
And Preyasi, remind the audience or inform the audience, where are you located?
So I work in Atlanta, Georgia. I work in a hospital about 30 miles south of Atlanta. I was raised in New York City, I was raised in New York on Long Island. I went to college and medical school in New York City.
So as an ER physician, day in the life of, what does it look like for you? Maybe like pre-COVID. Or even during COVID. I mean, you can go during COVID.
Yeah, I'll speak to both. I think, a day in the life of an ER doctor is really a day in the life of, I don't know what's going to happen. Like, I don't know what's going to come in. You sort of, I mean, to this day, and I graduated from residency in 2013 and I graduated from medical school in 2010. So I've been essentially been in the ER for over 10 years now. And I mean, I still say a prayer as I'm going into work, because you'll never be, there'll never be a day where you won't be shocked or amazed. And so I think you just have to be on your toes. So, I mean, you can walk in and your first patient is an elderly patient that may be having a stroke. And then your next patient is a young kiddo that has an asthma exacerbation. So you really have to be able to navigate from room to room and patient to patient.
Now, when you see children,
Mhm.
I would love to know what are some of the most common reasons that parents come in with their children? And then what are reasons, like on top of that, where they're coming in that it's completely non emergency that you see the most of?
Oh man. So, okay. So obviously my disclaimer, anything I say is just general medical advice and truly is more just my observations as a clinician. Um, I will say that my perspective on what truly is an emergency and what is not an emergency has shifted from being a mom. So I would have said, oh, kiddos come in with a runny nose and, probably don't need to come to the ER. But I know that when my daughter, and I'm board certified trained, 10 plus years experience, when my daughter had a runny nose, my first phone call was my sister, who's a pediatric hospitalist. So I have a pediatrician on standby at all times. So with that being said, I mean, I think I always say, and this is what I say to all of my patients, if you are worried about what's going on, if you're uncertain, then come to the ER. Come to the ER and seek medical care, because even if you have a stubbed toe and you just need me to say, you're going to be fine, I will happily do that. And truthfully, in this setting of COVID, that's even more important. We are sending patients home um, in like early on in their illness and COVID, that when they're safe to go home with the advice saying, listen, if your condition gets worse, because this disease can go one of two ways, then you have to come back. And so come back and we may tell you the same thing, that everything looks good, your vital signs look good, you can go home. But I'd rather you come back and see one of us so that we can reassure you.
I think that like I have a friend who, when she was a new mom, her daughter like spiked a fever.
Mm-hmm.
And I think she gave Tylenol and then like the fever didn't get better. So she ended up going to the ER.
Mm-hmm.
And one of the physicians there was kind of like, or the nurse was like, oh, like new mom, like kind of made her feel bad for it. So it's nice to hear you say you actually feel the opposite. Like, no, nothing is too small if you're worried about it, because as a parent your gut kicks in and tells you,
Absolutely.
and it's like if your gut is telling you that you need to cross all the T's, dot all the I's,
Mm-hmm.
then do it.
Yeah, absolutely. That sixth sense of a mom, no amount of training and education can ever trump that. What a parent knows, and a mother's instinct is, I will totally understand and work up just to be certain, because I want everyone, I want to make sure that when my patient leaves the ER, their family members leave the ER, that they feel comfortable going home. That's the first question I ask when I talk about, hey, I'm going to send you home. Do you feel comfortable with this plan? If you don't, let's talk about why. And if you do, then that's great. It's just important to trust your gut instinct.
Outside of children, just what are some of like the wildest scenarios that you've seen?
Oh my God. Okay. Huh. I mean, I've been I've been put in situations where I had no idea what was going on. This is definitely like XXX rated. So I had
That's
and it
okay.
was
We have an explicit rating, so
okay,
you can go
okay.
for it.
So I used to be the night doctor for for my group. So I worked only nights for, I think, for a year and a half. And so sometimes you'll tend to get these sort of vague complaints at like 3, 4 in the morning. That night there happened to be two female physicians working in the ER, and I walk into the room, and the complaint was like, I just can't pee or something. I walk into the room and I'm like, okay, if you can't go to the bathroom, like let's like do a bladder scan, let's do the full workup. I mean, this gentleman ended up having first asked for another physician, asked for a male physician. I was like, I'm sorry, I'm the only one here. Um, and he ended up having multiple rings around his penis. And I had never I'd never seen that before. So I mean, we had to go to lengths to get it removed. No pun intended. I mean, we had to really, really MacGyver how to take care of his problem. And he was so embarrassed and mortified. And I felt so bad for him.
Like cock rings?
Yes.
Yeah. He was like, there was a deal at the local,
I don't and it
store.
was multiple. And I was like, couldn't we have just been like just one? But no, it was like multiple. So I mean, it was I mean, I think all the nurses and everyone, I had no idea what that was. And so my first look was I was perplexed. And my nurses were like, well, this is, a ring around the penis or a cock ring. And I was like, oh, okay. I'm sure I instilled a lot of confidence in him, but we figured it out. He was fine. He could urinate after he was totally fine when he left. But I mean, those are the kind of things that no amount of training prepares you for.
I feel like anytime a doctor is asked that question, a lot of times it comes down to something where it was like a sexual act that like went awry, and someone was like, hey, like, they come in a little bit, red cheeked, a little embarrassed, like, how, help me, how do I get out of this situation?
Yeah, and you just want to help them feel like you just want to, yeah, and you also are so aware of how embarrassed that they are. Like no one wants to be put in this situation. No one wants to see me. Like I understand that. You're just like, let me take care of you and I'll quickly get you out of here,
Yeah. Yeah.
But that's probably my wildest one. And it's probably not the most PG one, but that's probably the craziest thing. I mean, there are a lot of gratifying and, like gratifying patient encounters. I mean, even like, especially during COVID. And I think this is where you remember that this is where like the human aspect of COVID has really taken a toll on physicians. A lot of my job is to unfortunately sometimes deliver bad news. And no one can read your facial expressions. I mean, I have like another mask, goggles, a huge face shield. They can barely even hear me, let alone see my facial expressions or see my empathy or my sympathy. And so and then you can't even like put your hand on their back. Like you're very aware of social distancing, oftentimes not for me, but more so for the patient, their family member. So that's been really tough, and I've had patients come in where they've said, I've gone to so many doctors and I've gone to so many ERs and I don't know why am I still hurting? Why is it still happening? And then when you end up finding a reason, even if it is something like that's malignant or cancerous, they still are just that gratified or they're just happy that they have an answer for what their ailments are from,
Yeah, it can be very frustrating being a patient and you're in this gray area where you just don't know. You just don't have an answer. And you're like, it's almost worse being in the gray than receiving the diagnosis. Because then once you know what it is, you can put a plan in place, no matter what that plan is. But when you're just in the gray, you're like, I don't know where to go from here.
Yeah. And that's life in general, right? That's so many of us. Like that's in so many situations that we're in, like when we don't know what the hell is going on is when we're the most frustrated. And so I sometimes I'll have patients, family members just be really upset. And I'm like, because oftentimes my job in the ER is to tell patients that these are the things that I have eliminated. You're not having a heart attack. You're not having air where there shouldn't be in your chest cavity. You don't have a pneumonia. You don't have a blood clot in your lung. But they're like, well, what is my chest pain then? And that's where I have to be very I have to make sure I convey to them that not having an emergency is a good thing, but you definitely need follow-up, And I understand the frustration because I myself was frustrated when I was given the diagnosis of unexplained infertility. Like, what does that even mean? It's very humbling.
And I want to talk about that, not only your journey with it, but also the position of going from physician to patient and how that felt and that entire
Yeah.
process. So, to give us a little backstory, can you share maybe when you received that diagnosis, what that was like, and then up to where you are today?
Yes, absolutely. So you know, um, I've always been very linear in my life. Like, and you probably remember this as well, but like, I went to college, I went to med school, I went to residency, finished residency. The next thing was, okay, I need to get married. I got married. And the next step was having kids. And, in every point in my life, when I worked really hard for something, I was able to achieve it. And so when it came to fertility, I felt very similarly. I was like, I'm going to get ovulation kits. I'm going to like make sure I like use them properly. I got the best ones. And like every morning I would like pee on a stick, find out when I was most, fertile. Um, but after about 6 months, um, you just got that like instinct that you're like, something's not right. And so we went to the fertility doctor. And of course, I was 32, or I was 30, 31 or 32 when I first went to see the IVF doctor. And she was like, everything, she's like, you're young, you're healthy, your cycles are normal. So you should be fine. This should, we'll give you some pills and I'm sure you'll get pregnant. And then, once my blood work started coming back, she was like, I think we just need to get for like the assisted technique, um, train right, sooner rather than later. And I remember when she told me that, it was just a knock to my stomach, right? Like, we're taught that getting pregnant is like the easiest thing, right? Like, you're avoiding getting pregnant when you're 20s, like, and then all of a sudden you're like, I want to get pregnant. And you think it should be so easy. Everyone around you is getting pregnant. Like, no one seems to have an issue. And I remember saying to myself, like, India has 1 billion people. There's no way I'm going to have a problem getting pregnant. It's not in my genes. So when it sort of knocked the wind out of me.
And at that point, was Viraj tested as well? And
Yeah, he was tested and his numbers are great, we're wonderful. And when we did a digger deep into sort of my fertility, my follicle counts were on the lower side. My hormone levels were on the higher side of normal. So everything was still normal, but they were at the either ends of it, higher or lower than what they should be. And so, we started doing IUI, and I will tell you, those few months were the hardest.
what is IUI?
So IUI is intrauterine insemination, and it's essentially, I was on a medication called letrozole to help, grow your follicles, and then they, inject sperm into your uterus. And so the idea is that you've taken a lot of the hard part out of it, traversing the vaginal canal and making it going past the cervix. So that was all that, they seemed pretty confident that that would work. But once the first negative pregnancy test we had, I remember just sobbing. And then the second one, I was broken. I felt so defeated. You feel like there's something wrong with your body. And all that's like that self-loathing comes in, which is so terrible. But you just, you feel like this is the most natural thing that I can do. And why is my body not doing it? And, I remember that the morning after our second IUI, we found out it did not work. I remember waking up the next day and being like, this decision is mine, how I proceed with this. We can do another IUI or we can go to IVF, and I can do it with a smile on my face, or if I can do it battered and broken. Either way, I'm going to go through with it. One way is going to be less painful than the other. And so I remember thinking, I'm like, this stuff should be like natural. Like, none of it's like a deliberate process, but this was a very just deliberative decision for me to be positive about it. And, I think that was in May, June. And then we started that, we were on the IVF train and we were on it for a while.
And then you did become pregnant. It did
It did
work
work.
for you.
Yes.
So how many times did you have to go through the IUI process? Do you recall until you
Yeah,
received a
so I only
positive?
did it twice,
Okay.
after doing my own research. And I think, being a physician and being a patient, you start realizing that doctors are going to have your best interests in heart, but they're never going to be in your shoes, period. And so you have to do your own due diligence. And also you have to know what your limits are. So my doctor recommended 3 IUIs. Mentally and emotionally, I cannot handle 3. I said, let's do 2 and let's move on. And so she was on board with it. I think as a physician, I feel confident expressing my concerns or my opinions. I think oftentimes, most patients probably don't, but I want patients to be advocates for themselves. Please, like, ask me questions or tell me what your concerns are. Be open. Open dialogue will help any relationship, but especially a physician-patient relationship.
I can see that stemming in this situation where the patient is looking for this outcome, this ultimate outcome, and they want
Mhm.
it so badly that they're willing to almost do anything that the doctor
Yeah,
says. I could see it being, I know it's like a very different end of a spectrum, but almost like if someone was to receive a cancer diagnosis. It's like I don't even know what to do. I just want to not have this issue anymore, and I will do whatever you say. It's almost like your own boundaries and limits on what is appropriate for you are out the window because
absolutely.
your doctor almost feels like you're God in that moment. You're just like, whatever you say, I will do.
It's so true. I mean, it's so true, but I think, and for a lot of times, like, it's better to have someone that's objective, right? When you've been given a diagnosis, your rationality, you lose that. It goes all out the window. So it's nice to have someone that's objective about what your diagnosis is. But it's also equally as important as when you can get your wits about you, to make sure you're fully informed as well.
Now, when you were going through the IVF process, what was that like?
So I was really lucky. I was lucky in the sense that I had a friend that was literally going through it with me. And so we actually ran into each other at the fertility doctor. No, neither of us knew that we were there. And I remember seeing the look on her face, and she looked shocked and got pale. Like, you could tell that no one knew what was going on. And I was just like in my little happy, initial bubble of like, oh, this is going to work. IUI is going to work. And then when it didn't work, we ended up going through IVF together. And it was so important for me to remain grounded, that there was someone else going through it with me, and that I could vent to, and that I could talk about how upset I was about the other freaking, birth announcement that I received, or the pregnancy announcement that I received. Like, it was just really nice to have a safe space and not feel guilty. And you want that to be your husband, but he's also going through it,
Oh,
and they're managing it on their own, right? Like, I think we think infertility just affects women, but it affects the relationship and your partner as well. It's not just one of you going through it. And so, as much as I would want to lay on him, it was really important that I had someone else that could talk to me about it, that was going through with me. I didn't want to talk to my friends and family who had like no problems getting pregnant. I'm like, I'm sorry, I can't, it's too painful. Like, you can't relate. It was so easy for you. And so it was really nice to have someone that I could go through it with, and to go through the ups and the downs with, because that's what IVF is. IVF is, it's a roller coaster. Some days you're going to feel great. Some days you're going to have lows. We had gone through IVF in June. We had our egg retrieval in June, and our first transfer in August failed. And that's another blow, right? You're like, this is IVF. This is a genetically tested embryo. This is a good embryo it's gonna implant. And then all those feelings of, my body can't do what's natural. Like, it's been given everything and it still isn't working. Was that those feelings are revisited so often for anyone going through infertility. And so it was nice to have someone say, it's not your body, like it's fine, like, you know, you'll get through it, we'll figure it out. And I think for me, the moment that was the most like I felt like I had taken a huge burden off was I remember looking at my husband and I was like, you know, whatever happens, we're going to be parents. Whether we adopt, whether we do embryo donation, whether we do, we will be parents. I will be a mom. Like, and I think just saying that out loud to him was so powerful for me to hear that I'm going to be a mom. Biologically, mine didn't matter. I will be a mom. And so we put a lot of these stresses on ourselves. And I think when you write it out or when you talk it out, it's very cathartic and it can be transformative, you know.
And for anyone who's not familiar with IVF,
Mm-hmm.
what does the like step-by-step process look like?
Sure. So the initial workup, the initial infertility workup includes blood work, ultrasounds. They look at your anatomy. They look at your hormone levels. So you're kind of looking at, you know, your chemistry as well as your and like your parts. And so that's the first step. And then once you get your diagnosis, or if you have an unexplained diagnosis, the next step is to do an egg retrieval. And that process entails you give yourself daily injections of medications that are going to stimulate your ovaries to make as many follicles as they can. Because the idea is you want to go in and harvest as many eggs as you can. The higher the number of eggs, the higher the chances, right?
And then the injections are in a specific location.
They're all on your abdomen.
Yeah.
They're all on your tummy. They're all small with like a little insulin needle. They're very small, like very small needles, and they're not terribly painful, but yeah, for sure. It is uncomfortable, and more than even the shots, you become so bloated that you become uncomfortable. So that's step one. Step two is then the retrieval process, and then the next part is a transfer, where they actually put the well, I guess after the retrieval, they'll take a sperm and put it into the egg, see if it matures, make sure it gets to a certain day of maturity, and then either transfer it back into your uterus or they will freeze it.
And when they do the retrieval process as well as the implant,
Mm-hmm.
that's all done inpatient at a medical facility
Yes.
versus step one, where you are giving yourself the injections at home.
Yes,
Yeah.
absolutely. Yeah, you are at home doing all the shots. You go in every day for blood work and every day for ultrasounds. I mean, I was very lucky that my colleagues were so flexible with me because for 2 weeks straight, I was going in every morning for blood draws and ultrasounds.
Wow.
Yeah.
That's a lot.
It's time. Yeah, it's time intensive. It's financially a huge cost, you know. So but like you said, like people are willing to go through lengths, right, for this outcome.
And then your very first transplant was successful.
No, my first one
Oh,
was not successful. My first one did not take, and that was devastating. August 2nd. I can remember the date. Like it was it didn't implant. And so you know, but I think every single time I've had a letdown or a disappointment like that, I've felt like it's always led to something bigger and something more meaningful. And so um after that one failed, that's when I had my realization that, you know, I will be a mom no matter what. You know, it was it was accepting that things were out of my control. When you go through, a lot of us are type A, you know, especially physicians, but a lot of, you know, it's women that are, you know, we like to be in control. And so this was a lesson for me that no amount of hard work, no amount of like hard work in the usual sense was going to make me have this outcome. The hard work was really internal, was accepting that I had no control over this and I had to just let it go and be happy with who I was. And really, and I mean, I had such body issues because you gain all this weight and I was just not in a good headspace, even when we did that first transfer. So I'm like, in retrospect, you're like, well, thank God it didn't work because I got to really work on my mental health before it did work, you know. It's a precursor to being a mom, right? I mean, I feel like any woman going through fertility issues, they're already a mom. There's so much of so much of motherhood is out of your control. So much of it is accepting that you can't control everything. And so much of it is accepting the situation that you're in and finding the beauty in that situation.
And seeing everything reflected back to you
Oh
as
God.
just a, like it's like a crystal ball of yourself, basically.
Yeah.
And you're like, okay, I need to clean this up so that, this next generation or these future beings are what the good that I hope to put out into the world.
That's exactly right. I mean, a lot of what I do now, especially now having a daughter, is I just want her to look up and look up and look at me and be like, I'm proud of my mom, and I want to be the woman that I want her to be. I don't want her to have any body issues or confident issues or imposter syndrome issues where you feel like you're not good enough for something. I mean, and a lot of that stuff is just we didn't necessarily learn that from our parents or from society. We absorbed it, right? It wasn't an active learning process. It was just our environment. So it's so important for me to make sure that I am standing straight, I'm speaking up, and she sees me. And even if she's not around me, that I do it with her in mind.
Now, when did you have your successful transplant with your daughter?
So that was October 20th was the date that we found out it's my husband's birthday. Yeah, so it was so funny. I remember when we first got married in 2016. I remember for his first birthday in October 2016 that we were married. I was like, "Oh, how wonderful would it be if I could tell him I was pregnant today?" And that obviously didn't happen. And then fast forward a year, and I told him that we were pregnant on his birthday. It was the best feeling. It was the best feeling. And I think sometimes you think with fertility, the spontaneity of it all will be sort of taken away from you. And it was like the best story, best gift I could have ever given him. And
It
probably
probably
the last gift I've given him.
this is your first and only gift.
Exactly.
But it probably also makes it that much sweeter in a way because the two of you have gone through the journey together.
Mhm.
And then it's like, babe, we weathered this storm. Like,
That's so true. Yeah. I mean, you're absolutely right that was the first hardship that we'd ever felt together as a couple. I mean, granted, our wedding was huge and had a lot of stressors in and of itself. I mean, I had to escape to a yoga retreat a couple months before, but this was a true test for the both of us. No one else knew what we were going through except each other, and it was the first time he was seeing me be really hard on myself or be in a really dark place. And it was the first time that he had to sort of figure out in real time how to respond to that. And by all means, I was not perfect and he wasn't perfect, but we learned a lot from each other and we learned a lot about each other during that process that I would never take away.
and when you think about the work that you do, also, like, there's probably many people that maybe they have a type of job where they can ruminate on what they're going through throughout the day. Like, not that their job's not important, but like if I was going through that, yes, I need to focus on my work, but someone else's life is not in my hands and my
Sure.
day-to-day work. So for you to have to draw that line and say, like, I know that I'm working on this myself and like I have this scenario. I mean, not just during your IVF treatment, which was so taxing, but just even in every day. And then
Mm-hmm.
you have to show up at work and it's like you really have to leave everything at the door, which is impossible almost.
Yeah. But Katie, I think that's also what made it easier to go through. I mean, you for me, that was my be all end all. Going through IVF, like my life had stopped. Our life had stopped. We were just I didn't see my family. I didn't travel anywhere. I mean, my schedule was so tough with appointments. And then mentally, I was stuck in fertility and having a baby. But when you go to work, you realize that shit doesn't matter anymore. Like people's problems are really big, and patients are coming in, and it was just humbling, right? Like it reminded me every day that yes, this is a really tough thing that I'm going through, but there are a lot tougher things out there. And so, it wasn't as challenging as I thought it would be to be doing both. It was actually sort of I don't want to use the word escape, because it was just sort of it was a reminder
Yeah, it made it
that
relative,
it
like
made it, yeah,
relative
exactly.
to, yeah.
Absolutely. It was, you just are so, you're grateful for what you do have.
Well, and that can apply to so many people that look at their lives and even the last year and think like, my situation is really difficult and I'm having a hard time in whatever I'm going through. But then as soon as you kind of step outside of yourself and see what other people's challenges are, you're like, all of a sudden your challenges, not that they're not difficult, but it's like you're almost grateful for what you
Right.
have. And then you're like,
Absolutely.
man, like, you see what someone else is going through and you're just like, okay, like this
Yeah.
puts it in perspective.
Yeah, absolutely. I mean, I think that's what this year taught us, perspective, right? I mean, 2020 was supposed to be our family's year of travel. Like we were going to Hong Kong, we were going, it turned into something very different, but we gained so much perspective from it, like toilet paper is really valuable.
Right. Yeah.
Like, but family time is so valuable. And, you know, but I could have we can each choose to look at things through rosy lenses, or we can choose to look through things in a negative lens, right? And I just it's hard to always be in a happy place, and trust me, I'm most oftentimes than not, I'm probably not there. But it's a good reminder, right? These are decisions that we make when we wake up. How are we going to look at the day?
Now, part of this that you touched on was the expense side of it.
Mm-hmm.
So, for some people, is there the option that IVF could be subsidized in some way? Because I, please enlighten me on this because I don't know.
Sure.
Can you receive insurance coverage for any part of it?
Yes. So we were lucky. The first time we went through it, we actually did have insurance coverage. My husband's company, we had really good health insurance, and they provided health insurance coverage. The second time around, that was not the case. But it's actually individually, it's actually done by state. So I'm probably gonna say this wrong, but New York has infertility coverage. It's mandated by New York State that all insurance providers provide fertility coverage. Um, I think New Jersey is similar. I think maybe Colorado. I don't know about California, but yes, there's definitely some insurance providers will cover based on where you live. And some companies will provide it based on who you're working for. We had it the first time, the second time we didn't. And what was shocking was that the negotiated insurance rates are way lower than the out-of-pocket expense. So we had $20,000 worth of IVF covered when we had insurance. That was going to last like 6 retrievals. One retrieval cycle, when we paid for it out of pocket, was just $14,000, not including medication. So, I mean, this is something that I think needs to change. Why should my coverage in Georgia be different than someone who's going through it in New York versus someone who's going through it, somewhere else? It should be more. It should be more unified. And this is something that we don't have control over. And so hopefully one day we can be bigger advocates for this.
Well, and also, like, for example, your husband's company, you had the ability to pay for it, and then job changes. Can you imagine if you're someone that maybe didn't necessarily have the financial means and you're like so close, and then there's a job change, maybe unexpected,
Mm-hmm.
and then that happens, and it's like that dream or ideal scenario is kind of the rug is ripped out from underneath of you.
It's so true. I mean, it's so true. I had friends who had to took out money from their 401k to make this happen, or who mortgaged their house. A lot of physicians that I know had to take second and third mortgages on their house. And with IVF and fertility, like it's a slippery slope. Once you start on the road, you don't even know when to stop necessarily, right? Like we sort of lose ourselves in it, and stopping isn't even an option because we haven't achieved what we wanted to achieve, or we haven't exhausted it to where we feel satisfied that we've done everything we can do. It's just so unfortunate that cost has to play a role in this. That moms can't be moms because they can't necessarily afford it. And I know friends who are like, it's just too expensive, I can't go through it.
And even, on the like postpartum side of that too, like not even if you received IVF, but even just anyone who has given birth, it's like that aftercare. It's like, okay, baby arrived, like,
Yep.
Good luck. Yeah. And it's like, wait, no, this is just as hard, if not harder, than what I went through, which was really hard, for the last.
Yeah, no one prepares you for it. And this is where physicians need to do a better job of just recognizing it, right? Like it shouldn't be at a paper that you get at check-in that you just like, yes, no, yes, no, yes, no. Do you feel like you have the postpartum blues? Are you eating? Like there, it's very secretarial and like mechanical the way they ask it. It's not like, it's like a true delve into how are you doing, like what's going on.
Basically, after you give birth, your provider gives you, it's like 5 to 10 questions. It's like a one sheet. And it's like, how are you feeling? And it's a scale, like on a scale of 1 to 5, as good as I've ever felt or horrible. And you're like, today I feel great now, but 10 minutes ago I was like ready to bang my head against a wall.
Yeah.
And it's like, yeah, it's definitely like an antiquated, or it just doesn't dive deep and outside of going through the entire pregnancy process, or even maybe what you had gone through before, and then your postpartum period and what you're dealing with. Then
And
it's
the
like,
postpartum period can even last longer than the first 3 months, right? I mean, women have changes in their sort of their brain hormones and psyche for up to a year to 2 years, and so it can be delayed onset. And a lot of these things, and I think this is the same thing to be said for fertility. A lot of this stuff isn't spoken about. So if you don't know the terms, then you're not going to know what to look for. So for someone to have like be really sad and fatigued and not eating well or sleeping well a year later, they're not going to think it's postpartum. They don't know that, they don't have the vocabulary to know that. And so this is where we as women have to speak up and talk about our own and be real and honest, right? Like as honest as you can be, but to share your experiences so that people are educated, and they do know what to expect and they do know what to look out for.
now what was cool about your very first pregnancy is that your daughter and my son were born right around the same time.
Mm-hmm.
So I, unbeknownst to me, had no idea you were going through this. And then, I'm like working out pregnant, like super fatigued. And I remember you sent me this video of like, you're inspiring me and you're doing squats and you have a bump. And I was like, oh my gosh. Like I was so excited. And your beautiful daughter was born. I think they're just maybe like 2 or 3 months apart. I think they're pretty,
so, yeah.
Yeah, pretty close in age. And you and your husband decided again that you wanted to go down this route to try to have another child.
So I was convinced after the first time. I was like, well, my tubes are cleaned out, my body knows what it's doing, it's gonna be no problem, I'm gonna get pregnant right away. I was like joking with my husband, we're gonna have Irish twins, like they're gonna be the same, we're gonna have no issues. And of course things don't go as planned. So we had sort of talked about the end of 2019, if we were not pregnant, that we would go back to see our doctor. We had one embryo left from our prior retrieval. It was just an untested embryo. So meaning that we weren't able to find the genetics out on the embryo. So we'd gone back to see our fertility doctor. She, started the whole process again. Same thing in terms of like ultrasound, sonograms, ultrasounds, blood work, etc. And this was right when COVID hit. So we had scheduled our transfer at the end of March. In the middle of March, she says, you work in the ER, you're around COVID all the time. I don't think you should go through with it. There's not enough information about, about pregnancy and COVID. And I had taken off time for this retrieval. With my daughter, I'd taken off 2 weeks post transfer to rest. And I'd done the same thing this time. And so I was really disappointed, but it made sense. So we took a break. June, we did the transfer of that embryo and it didn't work. And I was devastated. And again, the thing about the human spirit is that it's so resilient, and the refractory time was a lot shorter. So I found out on July 4th that it didn't work. And July 5th, I was on to the plan. Like, what are we doing next? Like, what's the next step? And it was at this moment that I had told myself, or I thought about this sort of thought about this in passing. If I was going to go through IVF again, I was going to document it. I was going to talk about it, and I was going to share it, because as an Indian woman, we don't talk about fertility. We don't talk about infertility. We don't talk about miscarriages. We don't talk about not wanting to have kids. None of that. It is assumed that every woman wants to have a child and that every woman will have a child. And so we had started that. When we decided to start going through IVF the second time, I started journaling, talking about it, and posting about it on Instagram. And it was very therapeutic for me to reach out to so many people and to find out that so many women were going through the same thing, and we're finding comfort in going through it together. And so we had to do a retrieval all over again. And I aged, my ovaries aged, and, we only got one embryo that was genetically normal and, matured to the right amount. We transferred that in at the end of October. And I found out the day that Joe Biden was announced president that I was pregnant. So it was very memorable.
You're like, win for the country and win for me.
Exactly. Okay, so this is why we were waiting. We were just waiting to make sure that we had the right person in office before I could get pregnant.
Just having an understanding of what it was like your very first time going through IVF, and then seeing your beautiful daughter who is healthy and beautiful. She is adorable.
Thank you.
And then knowing what could happen again. This second time, were you more gung-ho on it? Yeah, we're doing this. Or did you feel just okay, I have one beautiful, healthy child. If this doesn't happen, that's okay. Were you just gonna see this through to the end? No, I know I can do this. I did it once.
That's a really good question. And I think I worked through that after the first transfer didn't work. And so when I was determined I really wanted my daughter to have a sibling. And a lot of my feelings of getting pregnant were not related to me wanting to have another baby. It was me more I want my daughter to have a sibling. And I was I had gotten to the best shape. I was back to pre-pregnancy weight. Everything was back to normal. My life cadence had a routine now. And so when I did it, I remember thinking to myself, why are we doing this right now? And everything for me is always very planned out. And so I remember being no, this time makes sense. I have time off. This is the right time. They'll be 2.5 years apart, or 2.5 years apart. It'll be good. When it didn't work, it was much more soul searching, because I was we're having to pay for this out of pocket. So it's going to be at least $30,000, $35,000 all in. And why are we doing this? And I remember just feeling my family doesn't feel complete right now. And I think that was where I was it wasn't just about Sia having a sister or a brother. It was more about, I wanted our family to be complete. And I think I had to allow myself that growth to happen and to really be invested in mind, body, and soul into this, And in terms of, we have to have that conversation though. My husband and I, how many times are we going to go through this? What is financially, it's expensive. And it's also, we are really blessed and grateful to have one, which is really hard for a lot of folks, right? Like a lot of people don't, they are unable to have one on their own. So we talked about it, and I think we had decided that we were going to go through it at least a couple times and then sort of go from there. And again, knowing that we were going to give ourselves grace and revisit after each time and each cycle what we wanted to do next.
I mean, I can't imagine, number one, going through that and then also being in a situation where you're working in an ER during COVID, like that, just not even knowing how that could affect, or if every day the office that you step into, it could be like that. So I'm sure that just all of it was not a decision that you take lightly, but also the fact that your husband is so supportive
Yeah.
of you and then of the process. Like, I would think that for anyone who's going through something like this, if they have a spouse, a significant other, or not, I feel so alone. I don't know what to expect. But having some sort of support system seems like the the game changer.
It was. I mean, it was, having him sort of hold me up or just sort of reinforce what I was thinking was so important. But I think with a lot of this stuff, it's so personal, right? Like at the end of the day, his response to me was always, this is happening to your body. Like you're injecting yourself with these hormones. You're mentally going to be going through, and like you're emotionally going to be going through a roller coaster. I mean, so what is it that you want? And I think he did put a lot of it on me, like, how comfortable are you? And I think um that was a lot of pressure because I'm like, I know you definitely want another one, and so, but I think, we learn to live in our reality, right? So we learn to live in what we know. And I think if you're going through it by yourself, there's also a lot of autonomy and independence in knowing that you are making these decisions for yourself and a lot of strength in that, right? Like if we were on different pages, and I know couples that have been on different pages, it can actually be stifling. Like I am not able to do what I want to do because my husband isn't on board with this. And it makes sense. He's allowed to have an opinion, right? Like he's
Yeah,
allowed to go through it. So it's,
Are we?
Yeah,
on both hands, there's pluses and minuses for sure. And I am so lucky and grateful that I had a partner that was truly a partner in this. But we're a lot stronger than we think we are. And so even going through it by yourself, I have no doubt we can go, you could do it. You could do it.
What would be a key takeaway that you would want to share with the audience?
So I think, I think for me, the biggest takeaway that I would hope someone would get from this is just, knowing your own strengths, knowing your own value, and knowing your own story. And your story, each person's story has so much value. Your voice is unique, your perspective is unique, your expertise is unique, right? I am an Indian woman who is an emergency medicine physician who went through IVF, and that is what I can speak to. And there have been so many people that have reached out to me looking for advice, because I'm Indian, and they're like, no one talks about this. How do I talk about it with my family? And Indian families are very opinionated. And so I would want people to know that their voice really matters, and that they can make an impact in their own circle.
Are there any resources that were helpful for you or that you would recommend to the audience, if it's website, book?
So I think I did a lot of I have a hard, like a tough relationship with the internet because it can be really helpful, but it can also be very, anxiety provoking.
You mean you have patients coming in daily who are Google doctor dying?
Oh yeah, exactly.
Yeah.
Exactly.
That would be
And then you
me.
see all
I'm
the
like
worst,
that.
the worst case scenarios on like, fertility my biggest advice was do your research, find out what you need to find out, and then close the computer, and then don't research it again. People say this all the time, and it's the most obnoxious thing to say to someone that's going through IVF or infertility is just relax, it'll happen. It's so annoying, but I will say that the truth in that is once you can find space to accept where you are, then that'll be where you can find, quote unquote, your ability to relax. Just having confidence in your ability to know that you will get through to the next step, whatever that next step is, will be empowering.
You have created just a separate IG account to document your journey and to talk about this. So can you please share where the audience can find you?
Yes, it's on Instagram. It's Preys, Preys MD. It's sort of my little passion project. And hopefully one day I really want to get into infertility advocacy and making it more equitable so that all of us have the same resources on hand, for sure.
Awesome. Yes. Well, thank you so much for joining us. We are beyond excited that your next edition is on the way, potentially, arriving in July. I'm a July baby. So I have
What is your birthday?
The 20th.
Oh, yeah.
So
could be.
I'm rooting for July 20th. You had the October 20th confirmation.
That's
so I'm
right.
hoping, with Sia, so I'm hoping a July 20th.
Yeah, that's right.
Yeah.
Right on.
Fingers crossed everything goes well. But this was so great. Thank you so much.
Thank you. And we just love hearing your journey and appreciate you being so open.
Thanks for helping us elevate the vibe.
Oh, anytime.
Hey there, Vibe Hive babes. If this podcast has brought you any value, please rate and review on your favorite listening platform. And if you're feeling really generous, share with a friend. Visit us at elevatethevibe.co for show notes on this episode and previous episodes. This podcast is intended to educate, entertain, and inspire. It is not intended to diagnose, treat, or substitute for professional medical advice. Please consult your healthcare provider with any questions you may have. And as always, thank you for joining us to elevate the vibe.